Well, I think in a way what might be quite useful to raise is, yes, there are more eating disorders. I think anorexia nervosa one, not only that is in some ways the most visible one, it's also the one with the highest risk, and therefore probably draws the greatest attention. And it is also the one that affects the youngest people, because the onset is in early adolescence, and that's of course when a lot of parents are still involved. Bulimia tends to have an onset slightly older youth, young adult. And I think what often is also a challenge is that you can't see on the outside in terms of what their body looks like, whether they're suffering from an eating disorder or not. Bulimia is often characterized by a lot of secretive behavior, but at the same time also by shame. Most people will know that bulimia nervosa, the symptoms are binge eating, and then followed by purgings, often self-induced vomiting, but can also be laxative abuse or obsessive exercising, hyper exercising. And it tends to happen on the back of restriction. And the usual, and often already going a bit further, that core treatment is a specialist CBT treatment. At least it has been for many years. And if one looks at that kind of cycle, we can usually see people say, I don't feel happy about my body, about my weight, my shape. And they increasingly become more and more unhappy about it. And then often in conjunction with the societal pressure about kind of thin ideals, and tend to be also a combination of not feeling so confident within their self and wanting to have a source of feeling better or better to fit in. They start dieting and restriction. That restriction, I will come back to that a little bit further in a moment, is usually, or for many people, not sustainable, and then tends to lead to a binge, which then increases again feeling bad about themselves, then also the purging effect and even feeling more bad about themselves, not in the immediate relief, but usually sometime later. And then they start the next day with dieting again, and then that cycle goes on and on and on. And what one should, I think, be aware of, that one, that kind of cycle tends to get worse and worse. But two, and I think it's important for general counselors, clinicians to understand and to know, there is a significant medical risk factor involved, because due to the frequent purging, the electrolyte levels change, in particular potassium, and potassium is essential in terms of basically ensuring regular cardiac kind of functioning. Yeah. And that can even be life-threatening. So it's quite important for any counselor who does see someone to actually ask specifically about the frequency of purging, and to ensure that they go and see their GP. That requires them, depending on blood levels, frequent monitoring, and often also supplementation of potassium. So that's probably one of the key messages to be aware of, regardless of what treatment or not. But you definitely have to ensure that that you manage and are aware of the medical risk.
Well, if you want to know more about the science of psychotherapy, come across to our website, thescienceofpsychotherapy.com, and our podcast of the same name, and learn more about the science of you.